Hello and welcome to another edition of Focus on Morris County. I'm Joe Garifo, Public Information Officer for the Morris County government. Focus on Morris County is a program that's designed to keep us up to date on the actions that are being taken by the Morris County Board of Freeholders. And the show is also intended to make us all more aware of the many facets of Morris County government. On this segment of the program, we are going to be discussing some county government issues with my guest. He is Morris County Freeholder Director Tom Mastrangelo. Freeholder Director Mastrangelo is in his third year on the Freeholder Board. He is a Montville resident, and this is his first year as director. Tom, welcome to the program.
Thank you, Joe. Thanks for having me here today.
Now, I mentioned that this is your first year as director of the Freeholder Board here in Morris County. How do you view the role of director of the board?
Well, I view the role as a person who basically helps some of the day-to-day activities of the Freeholder Board and interfacing with all the colleagues on issues that we have to get resolved, whether it's resolutions that are going to be put up by the board or and sort of lead in certain aspects on the day-to-day board activities.
Now, at the start of each year, the Freeholder Director generally sets out some goals that he or she would like to achieve. And Tom, I know one of your goals for 2013 was the freeze on the amount of money, tax dollars, used to fund county operations. How do you intend to achieve that goal of a tax freeze?
Well, Joe, we as you're aware, we are seeking a 0% increase this year for the budget, and frankly, you know, I've got to give kudos to the governor for the for some of the tools that we've been given. So we do now have some reduced pension. We have some reduced health care benefits. And those reforms are driving those costs down. So that has helped a great deal in seeking that zero, and we're just watching how we spend, and you know, we've reduced spending in certain areas, and while reducing spending, we're still delivering the critical services that are necessary for the county and for the citizens who have come to know and love this county.
Yeah, and I think that's probably a question that comes to a lot of people's minds when they hear a 0% tax increase. They worry about critical services. But I know you and your colleagues have stressed that you don't intend to impact critical services here in the county.
No, we don't, Joe. We're going to continue with the services that the county has, as I always say, come to know and expect, come to love. You know, Morris County is a great place, and our intention is to not only keep it a great place, but make it even greater. So,
now, one of those services is Morrisview Healthcare Center. Right. Now, in recent months, there have been some folks coming out to the public freeholder meetings expressing concern about the future of Morrisview Healthcare Center, in particular the long-term care aspect of it. But I know you have tried to allay those fears. What can you tell our viewers, and what have you told Morris County residents about Morrisview and its future, and what the freeholders plan on doing in that area?
Sure. You know, what I've continually said last year with the former board and with this board is that you know, as a board, we will continue to drive cost out of the model and still deliver the service that is there today. And we've done that through outsourcing, whether you look at Sodexo, who is our food contractor, you look at cleaning services, and many other aspects of that facility have been outsourced, and you know, we still get rave reviews. We're still highly rated as a nursing facility, a nursing care facility, and we'll continue to, you know, always look at ways to drive cost out, and we welcome input from you know, from our citizens to also give us some suggestions on how we can drive cost out. So
yeah. Now, as opposed to the operating budget, the county also has a capital budget, right. And I believe this year the capital budget may be just over $22 million. But when you first started, when you were first handed the capital budget a few months ago, I think it was over 30 or 32 million. How were you and the freeholders able to cut that amount of money from the capital budget?
Sure, Joe, and the goal of cutting is not to not to deliver service or not to deliver infrastructure. The goal is basically look at what do we need and what do we want, and let's address the needs first, and we have to implement those needs in that capital budget, and then we look at the wants and see if we're able to implement those wants. So I think it's just been a priority-based management of that capital budget, and please remember, when you drive that cost down of your capital budget, it does affect your operating budget because there's a debt line item in that operating budget, and if we can drive that down, we drive our operating budget down, and it's going to take several years for that to really reflect, but it's starting to do that now. So,
now, Tom, last year you were involved in a study of the county's information technology division. As a result of a study that was conducted, an internal study into our information technology division, the county is now looking for what is called a chief information officer. What will this position allow the county to do, and will it benefit the other municipalities? Will it benefit the citizens of the county?
Well, to answer the last part of that, it will definitely benefit the citizens and benefit the county. If you look at private industry, you look at some other government, most government agencies do have a chief information officer or chief technology officer, and what this person will be doing is perhaps re-engineering our information technology infrastructure, and for the goal of looking at how we deliver services, whatever those services will be. So with using technology, we will drive cost out of delivering the services that we deliver every day as a county, and so that's the first step to that. The second step that I vision is a shared services concept. Once we perhaps re-engineer our internal infrastructure, where municipalities run their financial systems, they run their tax systems, they run water management, billing, things of that sort. Well, as a managed service provider, perhaps, the county, we may be able to provide that service back to the municipalities. They may be able to eliminate their IT infrastructure to a degree, eliminate the any type of outside contractors that they have handling that, in order to drive their costs down at the municipal level, while we're still driving costs down at the county level. So that's going to be the focus of the Chief Information Officer.
And we should mention that this is your background,
yes,
correct? I mean,
yes.
Information technology, I mean, from what you're speaking about, right?
I've spent, my full-time job is information technology. I've been in the industry for over 25 years, and my love and passion is politics and being a freeholder here in Morris County.
Now, one of the goals, again, of the Freeholder Board this year has been transparency in government. Now, that's a term that we hear a lot about these days. What does that mean to you, transparency in government?
Well, transparency, as a citizen myself, I want to see what my government is doing. I want to be able to have government accessible to me in every form I can. And one of the ways we've done it this year, and when I ran for Freeholder, we ran on reduced tax, reduced spending, and create transparency, or more transparency. And we've been able to do that over the last year. We formulated a transparency committee made up of freeholders and a number of great employees within the county. And we prioritize what we should start to put up on the new website. I'll call it, because in fact it is a new website. And you'll see out there today, if you go to the Freeholder site, you'll see all the minutes from the meetings. You'll see the resolutions that have been passed. Eventually, you'll see a lot more information, such as purchase orders and contracts and that type of information. And this does take time because of the amounts of information that's out there through the county. But the bottom line is government to be accessible and for the citizen to see what their elected officials are doing and what the administration is doing.
Yeah, and in fact, we will give you the county's website address in just a couple of minutes. We only have another minute or two left, Tom, but I want to ask you, in previous years, the freeholders have taken their meetings on the road, so to speak. Some of their meetings, usually spring, summer, and fall. As Freeholder Director in 2013, do you intend to continue that practice?
Without a doubt, Joe. Actually, just this past Wednesday at the Freeholder meeting, we just got the list of the number of towns that we're going to be on the road, and so I think that starts in March, I believe. And actually, my hometown, Montville, is on the list, and Mount Olive is on the list. Deputy Director Scapicchio's hometown. So we're looking forward to doing that.
And we should mention that toward the end of last year, all 39 towns in Morris County were reached, and so now here in 2013, we're picking up from the top, from the beginning, so to speak. Freeholder Director Tom Mastrangelo, I want to thank you very much for being with us today. We've only just scratched the surface of county government issues, but if you have a question about something perhaps that we did not talk about during this segment of the program, you can call the Freeholder's office at 973-285-6010, and the web address that we just spoke about, the Morris County Government website, the new transparent website, is morriscountynj.gov, morriscountynj.gov. And once you're there, why don't you sign up for the county's electronic newsletter, Morris County Connections. You do that and you'll get county government news directed straight to your inbox. And while you're on the county website, you can also like us on Facebook, follow us on Twitter. You can view our past programs as well as other county informational videos on YouTube. You can browse through the Morris County Document Library, which you'll find on Scribd, and check out some photos from various county events on Flickr. I'm Joe Garifo. Don't go away. We'll be right back.
Are you pregnant, scared, or a new mother who can't care for your newborn?
There's a safe haven in New Jersey.
You or a friend can bring an infant to any hospital or police station and give up custody safely, legally, and anonymously.
No questions asked, no shame, no blame, no names.
Call 1-877-839-2339 or visit njsafehaven.org to learn more. Remember,
New Jersey has a safe haven for unwanted infants.
Brought to you by the New Jersey Department of Children and Families.
¿Estás embarazada, asustada o una madre que no puede cuidar a tu recién nacido?
Hay un refugio seguro en New Jersey.
Puedes entregar a tu bebé en cualquier sala de emergencia de hospital o estación de policía, de manera segura, legal y anónima.
Sin preguntas, sin nombres, sin culpa.
Llame al 877-839-2339 o visítenos al njsafehaven.org. Recuerde,
New Jersey tiene un refugio seguro para bebés no deseados.
Patrocinado por el Departamento de Niños y Familias de New Jersey.
Welcome back to Focus on Morris County. I'm Joe Garifo, and I'm joined on this segment of the program by Arlene Stoller. Arlene is the county's health education specialist. She is with the Morris County Office of Health Management, and we're going to focus a bit on the office during this segment of the program, but in particular we are going to focus on Arlene's role as health education, and specifically how that role plays out here in Morris County. Arlene, welcome to the program.
Thank you. Thank you for having me.
Thank you for being here. Before we get into the health education aspect of the office, Arlene, can you just give us a little overview of the county's Office of Health Management and the role that it plays here in Morris County?
Morris County Office of Health Management was created in 2003 primarily to coordinate with municipal health departments and to take on the lead role in developing emergency preparedness planning for public health emergencies. We also have a county environmental services group where we have a hazmat team that would respond to, let's say, an overturned tanker on the highways, anything with hazardous materials. And they also do the work of the County Environmental Health Act, which would be looking at noise issues, groundwater, solid waste.
Now, I mentioned at the beginning of the program that you are the health education specialist in the office. What does that entail, actually? What are some of your responsibilities?
Okay, so I say I'm a health educator, and people say, oh, so you're a teacher. No, we really look at behavior change in a community, on a community level. So my roles would be doing community awareness and community education on emergency preparedness, working with municipal health to look at challenges in the community that people might be facing in terms of health and lifestyle issues. And I also would be public information for health from the county when it's needed, giving information from the New Jersey Department of Health to the municipal health officers that they can share in their communities, to put out press releases to media, and to maintain our website so that we have current information that people would want.
Now, I would assume that one of the concerns around the tail end of 2012 and the early part of 2013 was the incidence of influenza that's been all over the news. Here in Morris County, though, Arlene, how would you characterize the incidence of influenza this season?
First, I just want to say that flu is unpredictable, and it is one of the most serious infectious diseases that we actually experience every year. And even healthy people can get very sick and have complications. So at the end of 2012, we started seeing a rise in people getting sick with flu about a month earlier than we usually see. In New Jersey, you see January, February incidents of influenza rising. We started at the end of November, December, and people tended to get very sick. And so when people are very sick, and a lot of people are getting sick, you tend to have very high demand for influenza vaccine.
Now, how do you know how many people are getting sick so that you can then say, well, it's been a moderate season or a light season? I mean, how do you track the cases of not only influenza, but of any disease?
With, let's say, flu or any other disease, especially influenza because it's nationwide, Centers for Disease Control and Prevention starts putting out reports of where elevated flu might be. New Jersey Department of Health does. We get information from the emergency room departments, so we can see a rise in people going to the emergency room with influenza-like illness. We track some schools report school absenteeism, and we do get reports about over-the-counter pharmaceutical sales for cold and flu medication. So we can paint a picture of what we are seeing. Plus, we also get reports from municipal health in terms of demand for vaccine.
Now, I assume that you and the other folks in the Office of Health Management were pretty busy this year in terms of trying to get the word out about influenza and prevention, the preventative steps that people can take. What are some of them? I know there are probably a lot, but some of the basic preventative steps.
Every year in September, we start promoting influenza vaccine. Vaccination is the best protection a person could have against influenza. To slow the spread of influenza, we look for people to be washing their hands frequently and thoroughly, covering coughs and sneezes with their sleeves, staying home when sick, which is a challenge for so many people. But if you've ever had influenza, I don't see how people want to get out of bed because it really does make you very, very sick.
Yeah. Now, you mentioned come September, you normally start to promote getting a flu shot, so to speak. But is there a bad time to get a flu shot, or can somebody get a flu shot anytime? Or because I know recently people were saying, well, it's still not too late to get a flu shot.
It's not too late to get a flu vaccine because there still is flu out there. Influenza vaccine starts shipping in August. We would promote it September, October. As we saw this year, there was such a high demand for influenza vaccine that there were people that, even though we didn't have any shortages, they had trouble finding them. So we'd like to have as many people vaccinated in September, October, when the supply is plentiful, it's not hard to get it, and we never know what that flu season will look like.
Yeah. Now, we talked about a couple of the preventative steps. What about if someone does get sick? I mean, you mentioned stay home. Anything else that a person can do? Is rest the best medicine? I mean, besides going to see your physician, I guess.
The symptoms are fever. It could be very high, but flu, you may not have fever. It's the body aches, the muscle pains. You could have a runny nose. There's a cough usually associated with it. and you feel flu-like. If you do, we always suggest you contact your healthcare provider, because there are medications they can prescribe that will lessen the severity, the intensity, and the length of the illness.
Now, you mentioned trying to get the word out to schools also, or monitoring the absenteeism rates in schools. But how do you and your office work with schools and school districts to get the word out? Do you go through the individual schools, the school districts, the superintendents? How do you do that?
We work with municipal health officers, and they maintain relationships with their schools and their communities. We will provide information and resources that they can easily send to the schools. We update it. And then this year, our health officer, Carlos Perez Jr., he spoke before a countywide meeting that superintendents were at. And he talked about the influenza season, and he provided resources for them. And also updated them. If they need information, they can look to us, and we can provide that.
Yeah. Is there a flu season? Does it vary from different parts of the country? Or what about here in New Jersey? I mean, when is there a flu season?
Flu season typically October to April every year. In New Jersey, we begin seeing flu increase around January. So it might start in California, you might see it in different parts of the country. This year it began more in the south and then started traveling.
Once flu season is over, what do you turn your attention to then?
We always have our attention on emergency preparedness. We do have a grant, and we have deliverables on that grant. And so we are doing public professional trainings. We have a medical reserve corps, which are people who are volunteers who will assist us in an emergency. We do monthly trainings for them. We're always looking for great speakers and interesting public health trainings. We're just out there.
Whatever comes up.
Yeah.
Now you mentioned preparedness. Now last year. Hurricane Sandy. I mean, how does one prepare for a natural disaster like that, be it wind, be it flooding? What are some things that we should be doing? How should we prepare for something like that?
I love this year that from the federal government, they have a slogan, resolve to prepare, because that's really what people need to do. And now we have experience with Hurricane Irene and Sandy, so people can evaluate what worked and what didn't work. Did you need food? I like to think of it as you prepare for no electricity for 2 weeks and flooding, because if you get water in your basement and you are relying on an electric pump, well, what happens if it goes? So I love doing community presentations on emergency preparedness now, because people have so many great ideas that they share, or challenges, and someone else in the audience might say, oh, this is what I did, and we've learned a real lot.
Well, experience is the best teacher, I guess, right? Once you go through something like that, you start to say, well, I did this, but this didn't work, so maybe I should try this other thing.
And then it also lets people know that emergencies are unpredictable. I said flu is unpredictable, so the better prepared you are, we know the better you fare in a situation like that.
Yeah. Now, you mentioned working with other health departments, Arlene. I know that a lot of towns in Morris County have either their own health department, their own health officers, or perhaps there's a regional situation where they contract with another town. So how do you and how does the Office of Health Management work with those towns? Or what is the relationship between the county and the local health departments?
We meet with the municipal health officers every month at their Morris Regional Public Health Partnership meeting. I sometimes represent them in different meetings throughout the county where public health needs a representation. And then I work with the health educators, where we get together and have meetings, and I update them on what's going on in the world of preparedness, and then they talk about programs they're doing and how well they're doing, and we share resources and ideas.
Is your office available? You mentioned that you enjoy making presentations, but are you available to go out to community groups, organizations, and speak on various topics?
Yes.
Okay.
And I mostly speak on emergency preparedness. For other kinds of health things, I might help a group coordinate with their municipal health departments. But I do Kiwanis, Rotary. I'm speaking February 23rd before a group of childcare providers on planning for different kinds of emergencies. Yeah, I love to talk to people.
Why don't we give some contact information to you if you would like to reach out to Arlene Stoller or to the Office of Health Management in Morris County. The telephone number is 973-631-5484. You may also visit the office's website at morrishealth.org. What are some of the things, Arlene, that they may find on the website?
We have a lot of health information, but this month is February and we're focusing on heart disease, so you would find this Valentine's Day, Love Your Heart for a Lifetime, and all the things you could be doing to live a longer, healthier life.
And of course that information varies from month to month. Arlene Stoller, thank you very much for being with us today. Now, if you have a question about county government that you would like to have answered, you can call the Morris County Freeholders office at 973-285-6010. You may also visit the county government's website at morriscountynj.gov. Once you're there, why don't you sign up for the county's electronic newsletter, Morris Connections, and take advantage of the various social media that Morris County embraces. You can like us on Facebook, follow us on Twitter, view past programs on YouTube. You can also check out some county documents on Scribd and look at some photos from various county events on Flickr. I'm Joe Garifo. Thank you very much for being with us. Tune in again next week at this time, won't you, for another edition of Focus on Morris County.